Have you ever experienced persistent digestive issues like bloating, abdominal pain, or unexplained weight loss, and wondered what might be causing them? Finding a clear answer can feel like searching for a hidden treasure, especially when symptoms are vague and overlap with many other conditions. When it comes to diagnosing celiac disease, an endoscopy is indeed a very important and often essential tool. It provides doctors with direct visual evidence and tissue samples that are crucial for confirming the presence of this autoimmune condition. The reason an endoscopy is so valuable is because celiac disease primarily affects the small intestine. During the procedure, a doctor uses a thin, flexible tube with a tiny camera, called an endoscope, to carefully examine the lining of your small intestine. This allows them to look for telltale signs of damage, such as a flattened appearance of the tiny, finger-like projections called villi. These villi are normally responsible for absorbing nutrients, and when they are damaged, nutrient absorption is severely impaired. Even more importantly, the doctor can take small tissue samples, known as biopsies, from different parts of the small intestine. These samples are then sent to a specialized pathologist who examines them under a microscope to look for specific cellular changes. These changes include villus atrophy, which is the flattening of those villi, and an increase in certain immune cells within the intestinal lining, which are hallmarks of an active celiac disease process. For those undergoing this procedure, it is vital to continue consuming gluten in your diet leading up to the endoscopy. This is because eating gluten stimulates the immune response that causes the intestinal damage, making the changes visible and detectable during the biopsy. If you stop eating gluten before the test, the intestinal lining might start to heal, potentially leading to a false negative result. The procedure itself is typically performed under sedation, ensuring your comfort, and usually takes about 20 to 30 minutes. While blood tests can screen for celiac disease by checking for specific antibodies, a positive blood test alone is not enough for a definitive diagnosis. It acts more like an indicator, suggesting the possibility of the condition. The endoscopy with biopsies serves as the gold standard confirmation. It provides the concrete evidence needed by visualizing the damage firsthand and identifying the microscopic changes. This two-step approach, combining blood work with endoscopy, ensures a highly accurate diagnosis. It allows medical professionals to differentiate celiac disease from other conditions that might present with similar symptoms, ensuring you receive the correct treatment plan. Ultimately, an endoscopy offers invaluable clarity by confirming the presence of celiac disease with precision. This definitive diagnosis empowers you and your healthcare team to confidently implement a strict gluten-free diet, which is the only effective treatment for managing the condition. This not only alleviates your uncomfortable digestive symptoms, but also prevents long-term health complications associated with untreated celiac disease, paving the way for improved well-being and a healthier life.